Welcome to today's webinar on writing good survey questions. We're very excited to be back with the second part in our 6-part series on basic evaluation topics. So today we'll be focusing on writing good survey questions. It's a little bit of a follow-up to the webinar we did almost a month ago now about pre- and post-tests. And we're very pleased to actually have Kristen Fernandez back to present this webinar to us as well. So before we get started, I'll say a little bit about who we are. This webinar is hosted by Capacity for Health at the Asian Pacific Islander American Health Forum. We're a capacity building assistance program. We're largely in San Francisco, and we have some adjunct offices in Washington, D.C., and most of our capacity building team is here in our San Francisco office. We're actually funded directly by the Centers for Disease Control and Prevention to provide free capacity building support services. So that can be a lot of different things. We do a lot of trainings, webinars, create materials, and we do a lot of one-on-one technical assistance. So we work directly with community-based organizations anywhere in the country who need support around strengthening their programs and their organizations. So anything around the organizational development or infrastructure, like board development or fund development, strategic planning. We also work around a set of specific evidence-based interventions and public health strategies that the CDC is currently disseminating. And we also do a lot of work in the areas of monitoring and evaluation, helping programs and organizations to understand what's happening, what's working, and how to improve their programs. So today's webinar and this whole 6-part webinar series are part of our capacity building services in the area of monitoring and evaluation. We'll talk a little bit more at the end of today's webinar about how to access further support and services from us. We do a lot of one-on-one work, so if there are specific issues that you'd like support on or questions that come up as a part of today's webinar or in other areas of your work, we would be happy to talk with you about the kind of free capacity building we provide. So we'll have some information about that at the end of today's webinar. Just a little bit of housekeeping before we get started. All of the participants on the webinar are automatically muted, and we will have plenty of opportunity for discussion as well as questions and answers. There's 2 ways that you can participate or ask questions. You can click on the Raise My Hand icon, and then we can actually unmute you and you can ask your question live. If you're listening to the presentation today through a telephone, make sure to enter your audio PIN. If you don't do that, we're not actually able to unmute you so that you can ask your question live. If you prefer just to type in your question, you have a questions feature in the bottom right-hand section of your control panel. And at any point during the webinar, whether it's during a Q&A or during the presentation, feel free to type in a question. We want to make sure that our content today really addresses your needs in your programs and organizations. Also, if anyone's watching the webinar with multiple staff or multiple people around one computer, if you just use that questions feature to chat in your contact information, we'll make sure to follow up with you so you can get copies of the slides today or any handouts or materials that we make available as part of the webinar. And finally, today's webinar is being recorded, and the recording will be available on our website after the webinar is finished. So thank you so much for joining us. I'm pleased to present today's presenter. As I mentioned, Kristen Fernandez did the first in our 6-part basic evaluation webinar series about a month ago, and she's back to do today's webinar with us as well. I've been working with Kristen for more than a decade now, since she was staff on a peer education program that we were both running. She's done a lot of work in the field of HIV as well as other public health issues. She's been a health educator. She's done research work. She's been a program manager. And currently she's working with a number of different health agencies, including ourselves, doing program planning and evaluation. And when she's not working, she has a 2-year-old, Sony, who's lovely and very sweet and very energetic. So, Kristen, welcome to today's webinar. Thank you so much for being with us. Kristen is going to do the majority of the presenting today, and I'll be on the line as well to answer questions and talk a little bit about what we see in our work with community-based organizations. So, Kristen, I'm going to hand it over to you.
Great. Thank you for that introduction, Sonia. Welcome, everyone. Thank you for being here today. So next, I just want to go over today's agenda. This is what we'll be discussing today. I'll be presenting for about 45 minutes with time for question and answer throughout the presentation as well as at the end. So feel free to type in your questions as they arise in the questions feature. So specifically today, we're going to be talking about survey objectives, how to administer a survey, types of questions found in a survey, problem questions, and question order. And as mentioned, we'll have some more time for Q&A at the end. Any questions before we get started? Okay. So up on your screen, you can see our learning objectives for this webinar. By the end of today's webinar, we hope you will understand the importance of having clear objectives for your survey, be able to recognize the different types of survey questions, be able to recognize problem questions, and have confidence to develop precise and appropriate survey questions for your agency. So let's go ahead and get started with our first section. So what is a survey? There are lots of different definitions, but one that we've chosen here is that a survey is a system for collecting information to describe, compare, or explain knowledge, attitudes, and practices or behavior. So technically the word survey actually refers to the process of surveying or sampling populations of interest, and the tool itself is called a questionnaire. However, most people these days interchangeably use the terms survey and questionnaire. So before we develop a questionnaire or a survey, we need to understand what it is we're trying to learn about. So this is called the survey objectives. So a simple definition of survey objectives is a statement of a survey's hoped-for outcomes. And an easy way to develop survey objectives is to just look at your program's objectives. Oftentimes programs will have goals and objectives written out. You can look for them in logic models or past grant applications, but those are really going to be the foundation of your survey, so it's important to locate those within your agency if you don't know where they are. They're going to give you an idea of what the program is hoping to change and what the specific indicators are that this change has taken place. If you don't know where to find these objectives for your program, be sure to ask a supervisor to help track them down because those are going to really help you develop your survey. So on this slide, let's look at some examples of survey objectives. So for example, your objective could be something like identifying what participants have learned from participating in your program. So that's pretty basic. Something more specific, you could be looking to determine specific behavioral risks for HIV among a specific population that your program wants to work with, for example, women, MSM, some kind of specific population. So the key to developing an effective survey is to keep it short while making sure that you capture all of the information that you need. And the first step is developing specific objectives like the ones we saw on the previous slide. So you can also list the information that you are trying to capture, but either way, these are going to serve as your plan for your survey. So once you know what information you're looking for, you can structure your questions to help you capture that information. After the survey has been developed, you can use your objectives to go back through your questions and determine if each of the questions is providing you with information that you need. And ideally, every question should refer back to the objectives in some way. And that's because any question that is not providing necessary information should be removed because we don't want to collect unnecessary information and we don't want to make the survey any longer than it needs to be. Any questions so far about survey objectives? You can go ahead and type them in or raise your hand. Okay, so let's move on. Let's talk about how to administer a survey. You need to figure out how to reach the people you're going to survey, and common ways that this is done is by mail, by phone, in person, and increasingly people are using the internet to do this. So let's go ahead and do a quick poll. I'm just going to ask you guys to type in to the window that appears on your screen, what type of surveys do you feel most comfortable using? This can be things you've used in the past or you would use in the future. So you'll see something come up on your screen that will allow you to select. Okay, just waiting for the results to come in. Great, so it seems like people are really comfortable with internet and a little bit with mail and in person. Great, so thanks everyone for your input. So let's move on to all those different methods. Just give it a moment for the slide to come back up. Okay, so first let's talk about mail. Not a lot of organizations do mail surveys these days because internet is so widely accessible, but sometimes mail can still be the best way to reach your population. Some of the advantages of mail surveys is that they're relatively easy to do. They have a lower staffing cost because no one has to actually help the respondents with the surveys. Sensitive topics may be answered more truthfully in mail surveys because they're often anonymous. Mail allows for greater complexity and length in the questions and answers, and that's because respondents can take their time with it and be more thorough. And also, not everyone has internet. Mail can actually be a more representative sample in certain populations, for example, the elderly. Some disadvantages to mail surveys, however, are response rate. Self-administered surveys in general have a far lower response rate than those given by an interviewer. And writing good questions is even more crucial in this type of survey because respondents have no one to ask for help if they don't understand a question. In mail surveys, respondents can skip questions, and that can reduce the quality of data. And they're also kind of costly because of the cost of paper and printing and postage and things like that. Okay, so moving on to phone surveys and the pros and cons. Some advantages are that you have more control over being persistent with respondents and their participation because there's actually a person on the other end of the line. So that can actually give a higher response rate than a survey sent out in the mail. Because there's an interviewer on hand to explain or clarify what's being asked, the data that can be collected is much higher quality than that with a mail survey. However, the disadvantages are, a huge one now is lack of response. People are getting increasingly annoyed and unresponsive to telephone survey intrusions, and they don't want to have people calling them at home or on their cell phone to do surveys. Additionally, people really have limited time, so questions need to be very simple and clear and concise. Respondents also might be less inclined to tell the truth about sensitive topics when there's a person on the other end of the line. And also, some people don't have phones, so it can be a biased sample. So moving on to in-person. In-person surveys can be done a couple of ways. They can either be done as self-administered surveys, where you hand participants the survey and let them fill it out, for example, on a sheet of paper, or as interview-administered surveys, whereas a trained staff member actually reads the questions out loud and facilitates the interview process and records the answers on their own sheet of paper. So interview-administered surveys can give you a much higher quality of data than self-administered, and that's because trained staff can clarify difficult questions, and therefore the survey can be more complex and include things like skip patterns. In-person surveys also have better response rates because staff can be there to reinforce how important it is to complete the survey. But they also have a much higher cost because you have to pay for staff time and you have to train the staff and things like that. But staff training is actually very essential for this because each staff member has to ask the questions on the survey in exactly the same manner each time they administer it. And that's just to make sure the data is consistent and isn't biased. Also, honesty around sensitive questions can be a problem because respondents might be unwilling to discuss certain topics with a stranger. So socially acceptable responses, for example, saying you're drug-free when you're actually not drug-free, are more likely to be given in this type of survey. And socially acceptable responses is something that we're going to talk more about towards the end of this presentation today. Okay, so let's talk about internet surveys. It seems like a lot of you are really familiar with those based on our quick poll. There are several advantages to using the internet to conduct a survey. First of all, they have a really wide reach. A lot of people all around the world have internet access. There's no cost for paper, printing, or postage, much less cost for staff time, and there's in fact many types of free software online like surveymonkey.com where you can design your surveys and there's actually no cost at all. Because most internet surveys are done anonymously, it allows for a better chance of honest responses. And there's also automated data collection, which is a really great feature of some of the sites like SurveyMonkey. They will actually download your data for you into Excel tables or SPSS or whatever you want it to be, and that's much less time consuming. Some disadvantages to using internet are that not all populations have computer access, so this can really create a bias in terms of who's included in your survey. Also, the validity of data, if respondents don't understand questions, can be an issue. And it can be a bit of a learning curve to teacher staff and the respondents to learn this new software, if that's what you choose. So here's a quick table to summarize some of the pros and cons. So there's not really any one right method. It really depends on your program, and very important is your population and what kind of technology they know how to use, or what kind of questions you want to ask them, how sensitive they are. So things like that. So we just covered a lot. Does anybody have any questions so far about ways to administer surveys? You can go ahead and type them into the questions feature or raise your hand. Okay, so let's move on to the survey questions themselves. So in this section, we're going to talk about the 7 basic types of questions. We're going to talk about problem questions and then about question order. So let's start with the 7 basic types of questions and some examples of each type. So the 7 types that are commonly used on surveys you can see on your screen. So the first one we're going to talk about is called open response or open-ended questions. In general, open-ended questions are really great if you want a richer and more detailed answer. They allow the respondent to fill in their own answer and make it really personal to them. So for example, the answer to the question you see on your screen could be something like, I think my friends are nervous to mention it to the person they're having sex with, or I think it'll ruin the moment, or they're embarrassed to buy them, or there could be any number of answers to this question. This really gives you rich, detailed answers, but the downside to open-ended questions is that they take more time to analyze, and they can be hard to compare across different respondents. So next we have the partially open response. Here we have a question where there will be answer choices listed that can be checked off, but the last choice will say other and have a place to write in what this other may be. The options that are given are usually the ones that are really common. However, the participant also gets a chance to write in something if they choose. So it's kind of a combination. Partially open responses can be much simpler to analyze, but it can be hard to know what all the possible answer choices are or which ones are the most common. So that means the survey writer actually risks leaving out important possible answers. But one way that you can sort of avoid this is by piloting your questions with your target participant group beforehand. Partially open questions don't also give us the rich description that open questions do. So finally, we have closed response or closed-ended questions, and this is where we give all the answer options below the question with the instruction to just choose one. And the respondent can either check off their answer, circle it, or however else you design it. This is the easiest to analyze and compare across multiple respondents, but like the partially open question, it can be really difficult for the survey designer to know all of the possible answers and important options to be included, and they can be accidentally left out. So again, piloting your questions is really important here. So here's a summary of the advantages and disadvantages of the first 3 types of questions. So the way to think about it is just in general, the more open, the richer the data and the harder to analyze. Anybody have any questions about what we just covered? Okay, so let's move on to another quick poll. So if you want to understand in detail why people don't talk to their partners about condom use, or what type of question would you want to use? So you're going to have a place to choose. Open-ended, partially open, or closed response. So if you guys can just go ahead and select your answer. So think about what we just learned and decide which one you think would be the best choice for this type of objective. Great. So I'm seeing some of you chose open-ended and some chose partially open. Great. So the correct answer is open-ended, although partially open could definitely could definitely work well there as well, because we really want to give the respondents the freedom and the flexibility to share their opinions and their experience. So if you had just provided a closed-ended set of answers, you wouldn't get the kind of detail you were asking for. So an open response question is definitely the best option for this question. So good job, guys. So we'll just give it a moment for the slide to come back up. And we're going to go right back into another quick poll. How would you ask about a number of sexual partners for subgroups of your population to be able to easily code and compare answers? So for example, subgroups could be men, women, MSM, teens. If you wanted to know about the number of sexual partners for any of those subgroups, what kind of question would you want to ask? Great. So I'm seeing that all of you chose closed response. That's absolutely correct. Providing answer choices gives the interviewer a definitive mean of coding responses, and that's going to allow you to easily code and compare, which is what you want for this question. So great job. Thanks, everybody. So we'll just give it a moment for the slides to come back up. Great. So the next on our list is agreement scale or Likert scale questions. So many of you are familiar with these agree-disagree type of questions. They're called agreement scales, but are also commonly called Likert scales. And typically this type of question measures agreement using a 5-point scale with the steps labeled strongly agree, agree, neutral, disagree, and strongly disagree. So one thing to keep in mind is that when constructing any scale, there's a difference between providing an odd versus an even number of answer choices. With odd numbers of responses, like what you see above, there's always something in the middle, which is usually neutral. And research has actually shown that people will migrate towards this neutral in the middle. They like the neutral option, but one thing to keep in mind is that it doesn't give us as meaningful data when everybody ends up in the middle. So with even numbers of answers, participants are forced to choose, and that's why oftentimes you see this scale changed to just say strongly agree, agree, neutral, taking out the neutral and then just having disagree and strongly disagree. People don't like it as much, but because they're forced to choose, but it does actually give us better data. So this is something that you're going to have to think about when using agreement and Likert scales. Also, the ends of the scale need to represent opposites and have an equal range in between them in order to make it fair. So you don't want to see you don't want to do what you see last on the screen here. This would actually need a disagree option to match the agree option. So it's important to make it balanced. So with agreement scales, you can also set up an answer bank that can be used for multiple questions, and that really saves some space on your survey instrument. You want to make sure to give clear instructions when you're using this, this type of situation, and say something like, use the scale to answer the following questions, and remind respondents to circle only one to eliminate any potential confusion. Okay, so moving on, let's talk about another type of scale, which is called a rating scale. Rating scales are ones where you're asking the respondent to apply an absolute value to an item without regard to the other items. So this is really similar to an agreement scale or a Likert scale. So for example, you can look at this question up on the screen, and people can rate how important to them each of these factors are regarding choosing a sexual partner. Now, they can choose 9 for all 3, or they could choose 3 for all 3 if they wanted to. It doesn't matter. They can choose it independently of each other. On the other hand, ranking scales, which you'll see on the next slide, require the respondent to sort their items by assigning a numerical value. A numerical value. However, you actually want them to rank with regard to the other answer choices in this case. So they want to be actually looking at all of their options and rating them in relation to what's before and what's after it. So you can only use each number only once. So you can only have one thing ranked first, one thing ranked second, so on and so forth. So these types of scales are easy for participants to make mistakes on because they have to remember which answer responses they've already used. These questions actually work great for online surveys because the computer program itself will actually prevent people from using the same ranking more than once. So that's one thing that's handy about things like SurveyMonkey. Also, you really want to limit the number of things you're asking people to rank. You don't want to give them a list of 30 things and ask them to rank things from 1 to 30. That would just be too much and they'd be more likely to mess it up. So you want to limit it to under 10 or ideally even less. Okay, anybody have any questions? I'm sorry, I just got my mouse just clicked on something and I ended up in the wrong place. So let me just get back to my slide. Okay, I'm seeing a question come in. It says, rating scales and ranking scales are interesting to use, but brings up challenges in analyzing data. Any ideas or tips on analyzing these kinds of questions? Thanks, that's a great question. I think that they can be challenging to analyze data in some cases, but if you have good coding and you have especially if you have a computer program and you do these kinds of questions on SurveyMonkey, like I mentioned, they will really analyze those data really succinctly and clearly for you. So I'm not quite sure exactly what challenges that you might have, but if you have coding for those answers, it shouldn't be a problem. So maybe you can type in more of what you mean, and I can answer that question more specifically. Any other questions? Okay, so let's move on to our last basic type of question, which is checklist. So checklists are lists of items that people can check off, as many as they like. They're really similar to closed response questions, except that in traditional closed response questions, people are only supposed to choose one answer. It's important to include the phrase, check all that apply in these types of questions. These are also really great for if you're doing skill demonstrations or other observable methods, where an observer, say, watches a participant and checks off various attributes or steps completed on the way to completing a task. For example, if you want to observe a participant put a condom on correctly and you have a list of all the steps that they need to cover, a great way to do this is a checklist. Okay, so once again, anybody have any questions? Okay, so let's move on ahead into problem questions. So there are a lot of ways to write bad questions on a survey, and there can be really subtle differences in wording and structure that can make a big difference in terms of how someone interprets the question and how they think they're supposed to answer. If questions aren't written well, the answers won't be good and the data won't tell us what we want to know. So we want to make sure that we are getting good, meaningful data, and in order to do that, we need to ask good questions. So really quickly, I just want to ask what you guys think are common mistakes that people make when writing survey questions. So you can use your own personal experience designing surveys or taking surveys, and you can go ahead and write these in using the questions feature. So what are common mistakes that you guys have seen or you think that people might make? Okay, so the first one we're going to talk about in terms of problem questions is the double-barreled question. This occurs when researchers ask respondents for a single answer to a combination of questions. So whenever you see the word "and" appear in a question, you want to check to see whether or not you're asking a double-barreled question. So here you can see an example on your screen. The shelter should give out needles and offer substance abuse counseling. Can anybody type in suggestions about a better way to answer this question? You can go ahead and type in with your questions feature. Okay, so a better way to ask this question would be actually to split it up into two questions, because you're really asking for two things here. People can't really answer both things in the same question, so just separating it out into two is the simplest way to solve that problem. Okay, so the next problem question is about competence. People must be competent to answer the questions they are asked. They may not know the content area of the question, or they may not remember far enough back in time, or sometimes people aren't able to estimate the number of times that they have done something. You also want to really be sure that your questions are at the appropriate reading level and your participants will be able to understand the questions that you're asking. So I'm going to go up ahead and put these two examples of bad questions. Can anybody tell me why these aren't competent to answer questions? Go ahead and type into the questions box, the questions feature, and let me know what you think is wrong with these questions. Anyone? Anyone have any thoughts? Okay, so in the first example, you know, how do your participants really know what the budget should go to or how much things cost? It's not really their area of knowledge or expertise. So really questions like this that are asking people to weigh in on things that they don't really know much about should really just be scrapped and be eliminated. In the second example, 30 days is a really long time frame, and people aren't really likely to remember accurately what they've done over that time frame. So another way to possibly ask this question is, have you shared a needle this week, or how frequently do you share needles? And I want you to notice here that the answer options are balanced, like we talked about earlier during Likert scales. So our third type of problem question is the irrelevant one. You want to make sure that the question is relevant to the objective of the survey. For example, if your survey objective is to find out what high school students know about HIV and AIDS, and this is regardless of whether or not they're sexually active, we don't really need to know if they've personally ever had sex. So maybe asking about their opinions would be more directly applicable to our survey objective. So number 4 is about length of a question. So while long questions can be very precise, they can also become very wordy and very complicated. And we really want our respondents to be able to read them quickly, understand the intent of the question, and select an answer without difficulty. So for example, you can see on the top a very long question, and below it you can see basically the same question asked differently in a much more succinct way. And this is actually going to really help respondents finish the survey if the questions are shorter. Okay, so let's look at another problem question, which is the negative. So the appearance of negation in a question always paves the way for really easy misinterpretation in terms of the respondents. So the issue of the negative is especially important with agreement scales or Likert scales, because with these type of questions, there's a tendency for respondents to actually agree more often than disagree. So because of this, survey designers need to be really careful not to point all their statements in the same direction. So you want to have about half of the items so that respondents are expressing disagreement as well. So you can do this by writing your statements that represent a typical point of view as well as the alternative point of view. And you want to do so without expressing negatives. So for example, you really don't want a respondent's answer to ever be, I disagree that the statement is false. That's really awkward and it's really confusing, and it can actually be a source of considerable error in your data. So moving on to number 6, which is the biased question. So someone's response to a question really depends in large part on the wording of the question. And some questions actually seem to encourage particular responses more than other questions. And when the question is biased, the respondent may or may not realize that they're actually being swayed to answer to answer in a particular way. So if you look at these two examples, you can see that both of them have been very subtly worded in a way that makes them biased. Can anybody who's listening identify in either of these questions why they are biased? What words or phrases make them biased? Great. So somebody said, the second one says abusing. At what age did you start abusing drugs? And that's a judgment. Absolutely. That's absolutely true. Anybody else have any ideas about why the first one, for example, is biased? Okay. So you can see that, moving on to the next slide. Great. Somebody wrote in, what if they don't agree with abstinence? Absolutely. So yeah, in the first example, specifying it has been suggested that, saying something like that will potentially lead the respondent towards that suggestion. And people tend to agree with anything that's plausibly propositioned unless the alternatives are presented to them or unless they have very, very firm opinions. So specifying just one alternative is a form of bias. And it loads the question, and it suggests a particular response, and that really puts the burden of disagreement on the respondent, which we don't want to do. So you can see in the better example, is abstinence a method that you would choose to prevent HIV/AIDS? That's much more neutral and less biased. In the second example, as we mentioned, the word abusing places judgment, whereas using is a much more neutral term. So you want to be aware of the social desirability of questions and answers. People want to make themselves appear well, and if any question is going to make someone feel embarrassed or stupid or perverted or irresponsible, there's going to be bias. So I will also want to talk about another way that bias can be written into a question. So go ahead and look at this one on your screen. The President of the U.S. has committed significant U.S. funding to the international HIV/AIDS epidemic. Does this seem like a good idea to you? So the reason why this is biased is because the identification of an attitude or a position with a prestigious person such as the U.S. President, can really create a biased response. So you want to rephrase that and take that part out. Okay, so one thing I also want to say about bias is that in some cases, a loaded question actually will produce a more truthful answer. So there are some cases where loading or making the question a little biased can actually help. People don't like to admit their perceived quote-unquote deficiencies. So in this question, we're asking about education. And by saying many people were not able to get all the education they would have liked, what was the last grade you completed in school, as opposed to just what was the last grade you completed in school, can actually elicit a better and more honest response, because it's going to help the respondent, it's going to dissuade the respondent from exaggerating their level of education. So by putting that statement, many people were not able to get all the education they would have liked, it actually normalizes the fact that many people maybe don't have a high level of education, and this can hopefully lead to more truthful responses. Okay, so our seventh type of problem question is the ambiguous question. An ambiguous question is a question that's too vague or too unclear, and participants actually can interpret these ambiguous questions in different ways. And if they interpret them in different ways, they're actually answering different questions, and that means that your data won't be as good. So this happens often when surveys fail to specify clear terms, such as period of time, and this can lead a lot of room for misinterpretation. So for example, in the first question, without specifying annual or hourly or monthly or whatever, we could get a whole different range of answers here, and it would be really hard to code. And in the second example, do you watch the news? It might not be a straightforward yes or no. Sometimes, occasionally, rarely, things like that can be better answer choices to give there. Okay, so there are two more types of problem questions, the overlapping alternatives and sensitive subjects. Overlapping alternatives is where the response categories are not mutually exclusive, but they overlap. And respondents can check more than one answer and have them both be correct. For example, tell us about your condom use. You can see here that it would be possible to check multiple answers because more than one of them could be true at the same time. But at the same time, we're only asking respondents to check only one. So how do they know which one to choose? So the correct way would be to provide mutually exclusive answer choices, such as always, frequently, sometimes, rarely, or never use condoms. They don't overlap, and it's less confusing and easier to choose an answer here. Okay, so finally, our ninth problem question type is that of sensitive subjects. A lot of what we ask for in the field of HIV, for example, are sensitive topics, so this is really important to think about. We want to ask questions that people feel comfortable answering, but a lot of times people may feel embarrassed, and this can prevent them from answering honestly. So it's helpful to embed the question in a series of other questions to take the sting out of the sensitive question, if you will. And it's also good to save sensitive questions for the end of your survey. And it's also, you can always make it clear that respondents do not have to answer any question that they feel uncomfortable with. So that's important. So as we mentioned earlier, it can be actually okay to bias or load a question that is sensitive. For example, if you asked, have you had an STD outright, people might be afraid to answer that question honestly. So putting an explanation before you ask the question, which can sometimes be seen as biasing or loading the question, it can actually normalize the behavior that people might have trouble admitting to in this case. And if the question is introduced in a way that suggests that other people might be in their same shoes, sometimes respondents will be compelled to answer more honestly. And again, if we present sensitive questions among a series of other questions, it feels less harsh than the sensitive question standing alone. So here's an example of a question that pertains to a sensitive subject. So does anybody have any alternatives for this problem question? You can go ahead and type in your suggestions to the questions feature. Anyone have any ideas of how this could be reworded? Okay, so a better way to ask this question could be, how many times have you had sex without a condom? This makes it easier for people to be honest. And I just want to point out that even if we do all these things, sensitive subject questions are still really hard to get honest answers to because people want to give the right answer. And this is called social desirability bias or social response bias. So let's talk a little bit more about that because it's come up a few times. We see this a lot in surveys, so it's really important to watch out for when wording your questions. Certain behaviors are seen by many people as socially desirable, and therefore they are over-reported. So things like being a good citizen, which would include things like registering to vote, voting, taking a role in the community, being a well-informed and cultured person, so things like reading newspapers and books and going to cultural events like concerts and museums. Fulfilling moral and social responsibilities would include things like helping people in need, actively participating in your family and with your children, or being employed. Those are all things that people tend to over-report on surveys because that's what they think the survey administrators want to hear. In contrast, things that can be underreported are things like illnesses, disabilities, illegal or quote-unquote frowned upon behaviors such as using drugs or alcohol, committing crimes, even things like traffic violations, and different kinds of sexual practices. And other things that are underreported are things pertaining to financial status such as income, savings, or other assets, things like that. So up on your screen, we have a checklist of things that you should go through when you're checking about if your question asks about socially undesirable behavior. So things to keep in mind when checking these kinds of questions is that open questions are better than closed questions because it allows people to give a more detailed response. Long questions are actually better than short questions in this case because you can kind of load the question and give more explanation to normalize the behavior. The use of familiar or slang words are actually chosen to increase honesty. Using informants, which is people close to the respondent to ask the questions, can also help. Again, consider deliberately loading the question and normalizing the behavior. And for socially desirable behavior, it's better to ask about the current rather than the usual behavior. Also, embedding the sensitive topic into a list of less threatening topics. So that reduces the perceived importance of the topic to the respondent. Also, consider alternatives to standard questions such as card sorting, activities, or sealed envelopes. The last webinar we did on pre and post tests has some examples of how to use alternatives to a traditional questionnaire that can be really helpful when talking about sensitive subjects. And again, you want to pilot your questions ahead of time to make sure that the questions make sense and also to determine how sensitive topics were perceived by the respondent. And last but not least, you want to attempt to validate answers from some outside source. So for example, if you're asking about rates of STDs and you're asking your respondents about how much, if they've ever had STDs, you want to check out community prevalence of STDs as an indicator of the accuracy of your survey data. So you want to validate it in that way. Any questions? I know that was a lot of information. Does anybody want to type in questions to their question feature or raise their hand? I know you guys must have some. Anyone? Okay, well, since there are no questions, let's move on to question order. So this is the last thing we're going to talk about today. Questions should flow in some kind of order on your survey so that one question leads easily and naturally to the next. So the order of questions affects how accurately and honestly people will ask them. There's been a lot of research around this. So in general, questions on one subject or in a particular part of a subject should be grouped together and asked consecutively before you move on to the next subject. And there should be transition statements to prepare the respondent to shift to a new topic if that's what's being done. And when questions have to do with respondents' behavior, just proceed chronologically. So it's really important for the opening question of a survey to be a very easy and non-threatening question. The first question of your survey is very crucial because the respondent's first exposure to the survey really sets the tone for the way they're going to continue with the rest of the survey. So you want to have it be very non-threatening, very short, and very simple. In general, it's best to order your questions from general to specific and to start with a broad question about a topic or issue and then ask more specific questions later on in the survey. So in addition, there are several types of questions to consider when you order your questions. We want to start with sensory questions or descriptions. This helps people to remember about the experiences we're asking them about. Also, these questions are really much easier and less personal, and therefore they're more comfortable for people to answer. So it makes sense for them to be at the beginning. Next, we can ask about knowledge and feeling questions, and then about opinions and values. And finally, analytic or action questions should go at the end. So these are the questions that ask participants to think about scenarios and indicate how they would act or what they would do, how they would think things through, et cetera, et cetera. It basically, in the analytic and action questions, it combines all the knowledge, skills, beliefs, and things like that from earlier in the survey into something participants can use in real life. So it's important to remember that these questions should come last because they're the hardest and they build on everything we asked earlier in the survey. And again, you want to remember to go from easier to harder and from less personal to more personal when ordering your questions. And that's because you want to give participants the opportunity to sort of warm up. And it has been proven through research that comfort increases over the course of taking a survey. So that brings us to the end of our content. If anybody has any final questions, go ahead and type them into the questions feature. And I hope you all learned something new today. Thank you for your participation. And we'll be online for the next few minutes to answer more questions and talk to you more about upcoming webinars and further resources.
Thank you, Kristen, so much for your presentation today. Before I talk a little bit about the capacity building assistance that is available and where these resources and materials will be on our website, we do have one question asking if there are any online tools for analyzing the reading level of survey questions. I don't know of any. Kristen, do you?
Online tools for analyzing the reading level? Is that what the question was? I'm not showing it.
Yeah, online tools to analyze reading level of survey questions.
If you're doing your questions in relation to health, there's a lot of information about health literacy, and I would go ahead and Google health literacy. There's a lot of work that's been done about how to phrase things or how to state things in a way that are simple and understand in terms of health. So I would start there. And they do a lot of, they have a lot of statistics on adult reading levels especially, and grade levels and things like that. So that's a good place to start. If it's not pertaining to health, I would just go to adult literacy resources. You can just Google that and try and find something in there.
In terms of assessing literacy of populations that folks might be working with, Kristen did talk in her last webinar about some participatory methods, and our next webinar, the third one in this 6-part series, which is coming up actually in early January, is focusing exclusively on participatory methods and alternatives to traditional surveys or traditional questionnaires. So one thing to think about when we're not sure about literacy levels is actually moving away from surveys altogether. Another thing that Kristen talked about in both this webinar and the last one is about pilot testing. So there's really no way, I think, to know what the literacy level of our specific population is unless we try out our surveys or our activities with them. So really piloting in terms of getting direct feedback from the folks that we're working with in our programs to know whether they understand, for example, a questionnaire or a question or an activity that we're going to be doing. If anyone else, any of the participants on today's webinar, have suggestions around assessing literacy levels and survey questions, please click on your raise the hand icon or type into your questions box. We'd love to share the information and resources that you guys have as well. So if we don't have any further questions, I just want to remind folks that the slides from today's presentation, as well as a recorded version of the webinar and links to other resources, are available on our website. We also have a new online resource center, which we have just launched. You can get to it from our Capacity for Health website, but you can also go directly to it. And all of our past webinars are on there, as well as lots of materials. And the website for that is library.capacityforhealth.org. So if you just put that word library at the beginning, library.capacityforhealth.org, then you'll be directed directly to our online resource center. And as I mentioned at the beginning of today's webinar, we are available to provide free individual capacity building or individual support services. So my name and email and direct phone number are up on your screen right now. And I'll put this slide back up in just a minute, but I wanted to also let folks know about the rest of this webinar series. So as we've said, this is the second in a 6-part series. The next one on January 11th focuses specifically on participatory methods and moving beyond surveys, so not using surveys at all, but using interactive activities that we can integrate in our programs as a way of measuring, particularly measuring some of our outcome objectives or things we're wanting to understand about how participants change as a result of being in our programs, whether they have increased knowledge or skill or confidence. So some participatory activities for measuring that. And then later in January, we're going to start some work around data analysis, particularly using Excel. And then we're going to talk about evaluation plans and quality assurance plans in February. So that's what's scheduled so far. We're always interested to hear from you about what you need or what you would like to see. So if there are topics that you would like us to do webinars on or that you need some individual support on, please let us know what would be helpful to you. So again, our website and our contact information is on your screen right now. We're going to go ahead and close out today's webinar, but we will stay on the line for another 5 minutes or so. If anybody has questions, please click on your raise your hand icon or type them into the questions box. And thank you all so much for being with us today, and thank you to Kristen for her great presentation.
Thank you, everyone.